the end point is not enough. You have to enjoy the journey. You have to be passionate about what you're doing. Otherwise, it's an impossible set of obstacles that you have to get through. You really have to, love what you're immersing yourself in.
Folks, I'm extremely excited about our guest today. We have Dr. Stephen Kalkanis, by trade neurosurgeon out of Harvard. Today, he serves as the Chief Executive Officer for the Henry Ford Medical Group. And for folks who aren't aware, the medical group and the health system, they're really two different enterprises. And Dr. Kalkanis leads approximately 2,000 physicians and researchers within the medical group. But look, this man has a ton of capacity. And let me just share a few of the other things that he does as well. Dr. Kalkanis also serves as the Chief Academic Officer at Henry Ford. He's the Chair and Senior Vice President for Henry Ford Health System. And most recently, Dr. Kalkanis, you have been appointed as the Associate Dean for Michigan State's new initiative and department, correct? And can you tell us a little bit about that?
We are very excited about our Michigan State relationship. We will hopefully soon have a branch campus, our own healthcare and health professional campus, medical school at Henry Ford in Detroit, thanks to Michigan State. And we're Spartans now. So it's been a great journey.
Yeah, that's right. Go green, go white. Congratulations on that.
Thank you. It's an honor to be here.
I want to point out something because I know my son Atlas is extremely excited to watch today's episode. And we always chuckle that my son's first experience with politics was in second grade at Way Elementary. And so our family had recently moved in from the Chicago area to the great state of Michigan, and we land in a wonderful neighborhood. And our son Atlas, who at that time I think was 7, is in second grade at Way Elementary, and he has this incredible classmate, and her name's Grace. And one of the marquee activities and events of the year was voting for mayor of the class. And I just vividly recall my son being so excited. He comes home. He says, "Dad, I'm going to run for mayor of the class. I've got a campaign. I've got a couple guys in my corner." He's like, "I need to come up with the slogan. And I've got to say like a 30 or 60 second speech." We literally worked on that for days. And he was so excited. And Samantha and I are like, "You could do it, buddy. Just be yourself. Just be the best version of yourself. Be kind and respectful to everybody. And great things will happen." Well, the election comes and goes. And the day of that, the election votes and the winner became public. He came home and he said, "Dad, I lost. I did not win." And I said, "Oh, that's all right, buddy. Did you do your best?" "Of course." I said, "Hey, who won?" And he said, "A girl by the name of Grace Kalkanis." And Dr. Kalkanis and I met shortly after that at a wonderful event to benefit Henry Ford. And that story has just always stood out in my mind as to how we've built our relationship.
And I don't think we've heard or seen the last of Grace and Atlas and their saga. They remain great friends in class. But that is awesome.
Yeah, that's right. 5 years later, they're classmates again, right?
Yes, exactly.
Yeah, so that's wonderful. I'm glad you're here. Typically, as you know, these conversations are around, the things that are most important to you, that you're passionate about, your upbringing, lessons, wins and losses. But we always start with asking 4 simple questions. First one, what is your favorite color?
My favorite color is red.
Awesome.
It's for me, it evokes passion and life and just, forward momentum. I've always been drawn to it. Don't know why, but red is my color. So
great. Favorite childhood superhero?
Favorite childhood superhero? Probably Superman. I was just sort of taken with the whole series and the saga and just being able to fly off and do cool things.
and Dr. Kalkanis has a resemblance. He has a resemblance.
You're kind. I don't think so, but
favorite afternoon snack?
Skittles is my downfall. So and I'm eyeing them in your office here, but it's not the afternoon yet, so I'm good. But
that's right. That's great. And last one, favorite musician or favorite song or record to listen to?
I've always loved you too. Bono, Beautiful Day, the whole thing. But I like Journey. I have a pretty eclectic, wide taste in music, some classical music, but those are some big ones. So.
Do you and Laurel and the children play music in the home?
We do, but we have crazy eclectic differences in tastes. Laurel is a country music fan. My kids are into rap and hip hop and everything in between. So the music gets played often in different rooms, but sometimes together.
That's great. And between Nicholas, Connor, and Grace, which one controls the selection the most?
Definitely Grace, our youngest.
Great. Awesome. So there's been so much in the 5 years that I've known you. There's been so much that I think has occurred in your personal and professional life, the evolution of your career, many pivots, many achievements, awards. I don't know if you would call them promotions. I think they're earned opportunities for you to serve and lead larger groups of people. When you look back at your career since leaving Harvard, what would you say is the one that stands out the most and why?
That's a great question. Thank you. It's been an honor. It's been a journey. I think all of us for the last 5 years, the last 2 years have been a crazy, tumultuous time. But I'm a neurosurgeon by training. I put in a lot of years. 4 years of college, 4 years of med school, 7 years of residency to be a brain tumor specialist. And I think that for me, the most endearing and probably the thing that I'm most proud of is being able to move the needle in that space and to help develop new treatments for brain tumors. As head of our national organization, the Congress of Neurological Surgeons, had a chance to be part of the White House moonshot for cancer, and also this concept of precision medicine. How can we take the same people coming into the same doctor's appointment with the similar scans, similar diagnosis, but we know they're going to respond differently. We have unlocked the tools to figure out who might respond to one drug or one treatment and who might. And if you know ahead of time that you're not going to respond, let's get that person on a different therapy to give them, a better chance at survival. So being able to contribute meaningfully to that journey at this moment when we have so many space age technology opportunities that we didn't have before to unlock those molecular and genetic secrets. I'm very proud of that, but at the same time, there were opportunities to help lead and move organizations forward. So I just feel very blessed to have been, at the right time and place during that arc of history and neuroscience and in cancer and then locally at Henry Ford.
As soon as I heard you begin to respond to that, I immediately thought about how different your decision-making process must have been when you decided to go into this field, to think 15 years of education before you were able to truly live your passion and your purpose on a daily basis, all day, every day. And we're in a society so focused on immediate gratification today, and everybody wants to be a business owner and a CEO at 18. When do you think you had the clarity that this was your life's path and passion?
Yeah. When you say 15 years, it would scare anybody off at the outset. And luckily for me, it sort of creeps up on you because you go into it thinking, okay, I'm going to go to college. And for me, I knew I wanted to be a doctor from a young age, but it was an esoteric, vague concept. Actually, in college, I majored in government and political science and had lots of other interests, knew I wanted to go to med school, and so did all of those prerequisite courses, but I wasn't thinking, okay, there's a 15-year block of time ahead of me. And then, did 4 years of college and then got into medical school, and most people think about graduate school as part of their journey, and so I thought, okay, that's another 4 years. And it was really only until I got into medical school that I thought, wait a minute, I'm getting really excited at this concept of maybe unlocking the secrets of the brain and getting interested in neuroscience and neurosurgery in particular. I remember as a young first year medical student, I shadowed a surgeon who took me into a case of a young woman. She was in her early 20s and was literally going blind over a period of a couple of weeks came on suddenly because of an expanding tumor in the back part of her brain. And so I had the opportunity to see her in clinic beforehand, went into the operating room, saw this amazing just window into what to me seemed like looking into someone's soul at the time. I mean, it's the pulsating brain and the intricacies of what makes us human beings and just sort of creatures that can feel and sense and do all of these amazing things, and see the tumor removed. And then a few weeks later, seeing her back in clinic when she's, being able to read an eye chart again, that to me, like that was like, wow, I've found what I wanted to do. And I wasn't thinking in that moment, okay, that means another 7 years. I just knew that, okay, if I worked hard, I might be able to do something like that someday. And then you get to the end of it, and then you say, wow, I hope it was worth it. Because there's an opportunity cost, right? I mean, others are going into business. They're starting companies. They're, going through their own path, which is great. But for me, I tell my kids and tell everybody, my residents and those who I mentor, that the end point is not enough. You have to enjoy the journey. You have to be passionate about what you're doing. Otherwise, it's an impossible set of obstacles that you have to get through. You really have to, love what you're immersing yourself in.
Yeah, I really enjoyed when you just said that and you drew that analogy. I listened to a podcast recently. And I don't know how old or recent it is, with Joe Rogan, and his guest was speaking about, the man who loves the walk versus the man who is obsessed about the destination.
Yeah.
The first will always.
It's true. And I think that it's odd because in neurosurgery and in many aspects of healthcare, you do have to keep your eye on the prize. We are very goal oriented. At the end of the case, the goal is to help the patient or to take out the lesion or to get to the other side. But that journey is so important. Otherwise, the end won't be as great as you expect. So to me, that's the most important lesson for kids coming in, saying that they want a shadow or are thinking about medicine or they want an internship type of experience. And when they get into residency, same thing. I mean, those 7 years in residency are formative years for anybody, but especially on a pathway to be a neurosurgeon or to be any kind of physician. Those are the years where you learn the most. You make your connections. You develop a rubric in your mind for how you're going to handle problems, and it's so critically important that you have to love doing it, because otherwise it's an impossibly long time to just put your head down and think, okay, I'm almost to the other side. I still draw upon my experiences in residency today when I make daily decisions. So it's something that really has to be taken very seriously.
What would you suggest, aside from loving what you do and learning to really enjoy the process and the journey, when young physician aspirants listen to this conversation, what would be 2 or 3 other things that you might recommend or suggest that they really pay attention to as they make these decisions?
The first and most important, and this is specifically for physicians, there's so many aspects that excite people about healthcare. There's new technology. There's the concept of innovation and discovery. There's using biomedical engineering to develop new tools. There's the pharmacology of new drug development. There's leading health systems and designing health policies, public health. All amazing, important things in our profession. But at the end of the day, you have to be sure that you are going into medicine for the most important reason, which is to help people. You have to have a passion for the patient. You have to have a passion for putting yourself not ahead of anyone or anything, but this concept of servant leadership and going into, in your business, you've seen there are many other and perhaps easier ways to earn a great living. And so medicine is a thankfully secure and noble profession from many aspects. But at the end of the day, the most successful physicians are the ones who do it for what I think is the most important reason, and that's to make a difference for people. All of those other aspects are critical components of being able to be successful and to make a difference. But when I interview young aspiring doctors for positions in our residency program or to hire them on as faculty, I'm looking for what drives them in their core, and that to me should be a focus on making life better for people. So that to me is the number one thing.
So let's assume that we have a young physician aspirant. They love what they do. They're committed to the process and the journey. Their passion and purpose is truly to add value to people and to enrich their lives through assisting them with their health. Who are the people that you believe an individual like that needs to have in their corner along the way to get through such a long journey in comparison to what, an undergraduate education typically requires, right? 4 years.
Yeah. It's a long list of people, and it's a journey. And I tell people that whatever success I may or may not have achieved, I could not have done it without mentors. Mentorship is the most important thing, and mentors take many forms. I mean, I've been blessed in my life to come from a very close-knit family. My father passed away from cancer when I was just 14, so that was a big blow to me personally and to my family. But my mom sacrificed everything to make sure that I had a world and a safety net around me that I could thrive in. I'm blessed with an incredibly supportive wife that also has sacrificed a lot for our family so that we can do the things that we want to do. But professionally along the way, at every stage, there was somebody either that I sought out or somehow we were matched. And in college, there were people who guided me on the path toward here's what you need to do to be successful in an application to medical school. In medical school, I had many shadowing opportunities, and those to this day, 25 years later, are still amazing mentors for me. And at Henry Ford, same thing. There are always people ahead of you in life and on the path that you think you might be on or want to be on, that if you look closely, you can learn so many things. And mentorship's a two-way streak. It's not a mentee just passively, gaining, receiving,
right.
Wisdom. It's that interaction that to me has been so rich. I learned so much from those who I mentor today, and I hope that, in my seeking out people, that I've shown my respect and honor to them and asking for their opinions, but also challenging and pushing back and asking pointed questions about, well, why did you do it this way, or did you think about any other options at the time, so that it would make more sense for me as I went along my journey. But honestly, in medicine, I think in any field, mentorship matters. It is critically important.
So I've definitely seen that, and as you know, we have a few mutual friends and people who've worked with you on your teams who I've become friendly with or acquaintances, and I've learned quite a bit about Henry Ford's culture through yourself and others and Mr. Lassiter, and I hear mentorship a lot. Is that a part of Henry Ford's value proposition in attracting some of the top talent?
It is absolutely in our DNA. It's in the fabric of who we are. I think that, at Henry Ford Health, our new mantra to the world is being able to make the impossible possible. Not a guarantee, but being a fierce advocate for creating opportunities for patients that they might not otherwise have. And so this concept of I am Henry is meant to be a tapestry upon which the rich diversity of our team can serve that goal for our community and for the country, really. And you only do that through mentorship, through making connections of within departments, newer recruits who are younger in their career and senior people, and we actively pair people up so that those relationships can happen.
That's great. How what are maybe a few of the other key themes in the value proposition for attracting talent to move to the state of Michigan from other parts of the country?
When I first came here in 2004, finishing residency, it was a hard sell for me personally and for recruiting those after me, because there was this whole Detroit question. I mean, I've spent 15 years in Boston, gleaming city on a hill. Like, why in the world? And, yes, I grew up here, but it wasn't a given that we would return, quite frankly. And we were just talking about mentorship. It was because of a mentor, Mark Rosenblum at the time, who reached out, and I saw a future through his leadership and mentorship that I could build here, and I've never looked back. But today it's so much easier because Detroit is just in the process of again transforming itself, and there was a pause through COVID, but I'm just seeing so many exciting forward momentum opportunities here where recruiting is easier. So that's the first thing. The second thing is that in medicine in particular, but I think really in any profession, people joining an organization and coming from a distance want to make a difference, and they want to be part of something that's larger than themselves. So Henry Ford's commitment to not just one patient at a time, or yes, you have a job and you're going to be seeing so many patients in clinic, and here's where you're going to be operating and so forth if you're a surgeon. They now are offered the ability to outreach into our communities, to be a faculty member at a world-renowned place like Michigan State, to have research opportunities that may not have been possible at other places, and also to really have a national platform, because I think more and more what we do here in Detroit and what we do at Henry Ford is an example for the country. In healthcare, you have world-renowned places that all of us know, like the Mayo Clinic and Cleveland Clinic, and they are phenomenal. But they really focus on only the aspect of that spectrum where people are going for their fifth and sixth opinions and they're flying in and out. They don't also have a commitment to the communities. I shouldn't say they don't have a commitment, but they don't have as large of a patient population that is local, that is invested in health equity and improving the lives of those around them. And I think at Henry Ford, we are mastering both ends of the spectrum. We have people flying in from all over the world for advanced clinical trials and advanced precision medicine treatments, but we're also tracking very closely our rates of disease and illness and trying to combat social determinants of health within Detroit and making Michigan, a healthier place. So I think that, I'm hoping, will be a great attraction for young physicians who really want to be at a place with that commitment and essentially to make a difference.
Can we invest a few minutes speaking about Detroit specifically?
Sure.
One of the things that Samantha and I observed as we moved here from Chicago, which many people would ask us, "Oh, why would you go to Detroit?" I'm like, "Look, it's just a little Chicago. Yeah. It seriously is very similar. The neighborhoods, the diversity in ethnic groups and culture, just so similar." I would say Detroit, having all the stadiums and arenas within blocks of each other, makes it really special.
Yeah.
If you enjoy watching sports and competition. Food scarcity, though. When we moved here, we quickly realized there's not just an overwhelming focus and need to address nutrition for children, but I'm guessing that nutrition, dictates the quality of their sleep, which dictates their ability to learn at their highest level, which dictates their ability and desire to maybe do extracurricular activities like sports or science camps or other things. I just find in my very limited education around health that, food matters, and the access to the right food or slightly better food. Is that a conversation within Henry Ford, whether it's the hospital system or the medical group? Can you speak a little bit to where that conversation, that need is within the organization or its philanthropic interests?
Yeah. It is an incredibly sobering and critical point. Not only food scarcity, but this concept of social determinants of health, and how from a young age small tweaks in the human condition that many of us take for granted, a good night's sleep, or a proper dinner the night before, or having parents at home in the morning to get people up for school, for kids up for school, that matters in terms of the rates of asthma, the rates of just paying attention in school, early dropout rates, diabetes, hypertension, obesity. And then if you take that cohort of individuals and fast forward 10, 20, and 30 years, their life expectancy is sadly, shockingly, in this great country of ours in 2022 still is a plague right in our own neighborhood. So it is something that we feel passionately about. This concept of health equity and our commitment to Detroit is what Henry Ford, I think that's really the tip of the spear in terms of our value proposition to the city. And a lot of us have often said that there's no great American city that really can thrive without a world-class health system. And, we at Henry Ford aspire to be that, not just for Detroit, but for the region. And as part of that commitment, we have to make a difference in social determinants of health. And I'll tell you, this hit home not just at the hospital, but in my own family during COVID. My boys, who are, my oldest is a senior, my youngest son is a sophomore now, but this was a couple years ago at the outset of COVID. They were watching the news and they were truly dumbfounded and shocked that there were food lines and soup kitchens of people, during the pandemic that really, it just made everything more stark and had, no access to food. And so they took it upon themselves to start a charity. They sold masks for meals, and I'm so proud of them. It's a plug for them that they raised, $15,000, $20,000 to give to the food effort in the city. But my point is, it happens literally a couple miles away from where we were living. It's not just in areas that you might think of as historically underserved, or you might see some blight in communities. It is a real problem. And so Henry Ford Health, wherever people see our blue sign, should serve, I hope, is a beacon for that commitment as well. And so nutrition, but also good health habits and exercise and access to healthy living situations, that makes it better for all of us, because there will be less of a demand on the healthcare system for basic needs, and we can focus on the aspirational aspects and not having to play catch up because of the scourge of diabetes, obesity, hypertension, asthma, things like that.
How can other corporate social responsibility has been such a hot topic for
Yes.
almost my entire professional career of 20 years. We've been talking about CSR since 2000, when I got out of undergrad, at the various organizations I've been a part of. How can other corporate neighbors partner with such an enterprise like Henry Ford? I just think about it, between the medical group and the health system. We're speaking about over 30,000 employees. Is that correct?
We have 33,000 employees that touch 2.5 million patient visits, individual unique patient visits every year. So this is
Incredible.
A significant footprint.
Incredible. How can other corporate neighbors, who do they reach out to at Henry Ford to just have a conversation about all of the different priorities and initiatives that you're really pouring into like a fountain, to maybe be a part of something, and through the aggregation, you can create this multiplication benefit?
Thank you for asking. Thanks for the opportunity. They can call me directly, but I would love to talk to them. But we have, for instance, in our cancer enterprise, something called Game On Cancer. And it's really, man, I'm looking at the awesome footballs and sports memorabilia in this incredible office, but it's this concept of, Game On Cancer, that we're here to fight and we're here to win. And we have relationships with many of our sports teams around the city. But with Game On Cancer in particular, we have a corporate outreach where companies from around the city and state can contribute to anything that is, in their value proposition wheelhouse. So some companies help, build ramps for wheelchairs for patients who, don't have that ability. Some buy groceries and pay the electric bill for those who are undergoing chemotherapy and can't work because of the scourge of financial insecurity, as also a byproduct of being sick. Others put it into, seed money for research and so forth. I'll tell you, one incredible partnership with some of our business leaders has been the advent of enhanced screening for cancer in underserved populations. We we have found that in some populations, well, nationwide, if you have a smoking history, for instance, or if you're around people who smoke, there's a 1 in 250 person chance that if we do a screening test, we'll find an early lung cancer that could be curable if it's found. But in some populations who've been underserved and who haven't had regular checkups, that number goes to 1 in 50. So literally 5 times the risk and rate of cancer, all of which is curable if we find it early. And so being able to pay for portable machines that can be put on vans and buses to go into communities and do, remote screening events and screening fairs for health screening, everything from raising awareness to, for colon cancer, for breast cancer, for lung cancer, for prostate cancer. These are things that truly can be cured with early detection, but it's not as simple as a healthcare system offering it, because that assumes that patients have to come to us. We want to be able to be a bridge to be more embedded into the community, and that's how corporate sponsors can do amazing things. And that's just with cancer. There's similar opportunities for other fields as well.
Great. Thank you for sharing that. I wanted to make certain that we allotted a little bit of time to just pivot back to some of your childhood and where you've drawn some of maybe just like where you drew some of the big thinking and the vision you've had for your life, some of the values that you've carried forward into business and your personal life in raising 3 children and the incredible family that you and Laurel have. Can you touch a little bit on what some of those values were that you learned maybe from your parents or the environment you were in as a child and that you've carried forward into your personal life in the hospital?
Yeah. So I come from a big extended Greek American family, and so there's lots of noise and energy and lots of love in that, but family is very, very important. And as I said, when I was young, I lost my dad from cancer, but had the support of a lot of loved ones around me. But when I raise, when my wife and I think today about how best to navigate these challenging times with raising our own 3 kids, we prioritize family time as much as possible. And it may sound like a silly thing, but dinner time is like a sacred time for us. So I may start rounds or meetings at 6 a.m. and I may have conference calls at 9 p.m. or I might have to travel somewhere, but from 6:30 to 9 p.m. ish, like that's a blocked out time that no matter what we're doing, we try and as often as is physically possible to sit around the table and just hear about each other's day. And I think that when you spread that experience out over many years, it matters. And so I don't have any real objective proof for that, but I hope that our kids have benefited from it. I know I have. And we all work very hard, but vacation time is important too. And so we try and do that as often as possible. And coming out of this COVID storm, hopefully all of us will be able to do a lot more of that. So.
Yeah, I hope so. I hope so as well. When you, I often wonder how someone who's devoted their entire life to medicine navigates the transition into becoming a chief executive officer for such a large business. And it's not because you don't pick up things along the way, but you are recognized as a very well-known, respected, and brilliant neurosurgeon. Now you're the chief executive officer over a few thousand physicians and researchers. I have to think that requires a different set of skills and muscles. Talk to us about the transition that you've been through in the last few years since you were appointed as chief executive officer of the medical group.
Well, first of all, it's kind of you to say. I tell this story that I signed on the dotted line and I started this new job on March 1st, 2020. And 13 days later, I think we all remember what happened. So that was not in the fine print. And being in a war room for 2 years during COVID was certainly a crazy learning experience, but you learn a lot about yourself and you learn a lot about your teams. And, I think that the lessons for me were just communication, just being there and just reassuring people that we will continue to move forward. And I think those are some of the traits that I learned and honed when I was chair of neurosurgery. I had the opportunity to start our cancer institute and our cancer program a few years before. And so that was an interesting stepping stone for me, moving a little bit out of my comfort zone sphere in the neurosurgery world and building something a little bit bigger. And I became really I guess excited about the future, thinking that, if you put the right people together and have the right ideas, and have the right plan, which is important, you can, instead of helping one patient at a time with each surgery, which to me is I still enjoy doing, and it still is so core to who I am, but to help larger groups of people and to make a difference in a community, that opened up a whole new world, I think, for leadership opportunities and for thinking, how I wanted to spend, the next part of my career. So, seeing some of the success of the cancer journey and building this pavilion now that we have on Grand Boulevard, that then led into an opportunity where, again, mentorship matters. Someone tapping me on the shoulder and saying, hey, you should really think about this, and took a hard look at the pros and cons, because there are always pros and cons in any decision that you make like this. But yes, I miss being, in neurosurgery more frequently, and certainly COVID has, I had a perfect plan laid out on March 1st about how I would, have my OR day and my clinic day, and I would, run the medical group at all these other times, and all of that went to the wayside. But coming out now and on the other side of this, I'm eager to kind of get back to doing a little bit of both. So.
What is one of the simplest things that you miss about being in surgery on a consistent basis, besides the impact, right, of what you do to help people? But what's just a simple thing that you're like, I miss that?
Two things. One, and thankfully I still get this because I still am able to operate, but that moment when you walk out of the operating room and you're able to sit down with the family and look in their eyes and say, you know what, we got it. We were able to, bring this patient through successfully, and to see the relief on their faces, and to know, and of course, not everything always goes well, or certainly in brain cancer doesn't always have a great outcome. But for me, it's being able to give hope, because I am buoyed and inspired by that. So I miss doing that more often, compared to, when I was operating all the time. The second thing is, when you're in the operating room, there is a peace, there is a serenity, there is this concept that, you're in the operating room, so the world kind of fades away, and there's no, 20 million Zoom meetings and calls and texts, and
Yes.
You are singularly focused on the most important task at hand, which is the patient on the operating room table, and in the roles that all of us have in the day-to-day craziness of endless sort of responsibilities, that I miss that aspect of it. So
You reminded me of how extremely OCD I am before I sit down with a client to discuss like a financial plan. Yeah. Is there something that you were obsessive about that you did every time before going into surgery that you can share?
Oh, by definition, neurosurgery is, OCD is normal in neurosurgery. There's a whole checklist. The rubric of going over every last imaging study and looking at every angle and the 3D models of, for me, and brain tumors, and, how close was it to a vessel in the critical portion of the brain. And then even the setup, how the patient is placed on the operating table, when anesthesia is first being delivered, making sure that you're there to look at all of the numbers and the vital signs to make sure that it's safe to proceed. At every step, and it doesn't end until the surgery's done. There's just a running checklist of every so yeah. OCD doesn't faze me as a neurosurgeon. It's part
requirement
of what we do. Yeah. So I appreciate that in anyone.
So you referenced servant leadership, and I wanted to make sure that I didn't forget to come back to this. So I think Simon Sinek is one of the greatest thought leaders on the planet right now, speaking on servant leadership, teaching and coaching organizations how to truly prioritize their people as their greatest asset, knowing that nothing great typically happens by the efforts of one person alone, right? It's collaboration, it's teamwork, it's It's creating an environment where people have a great vision and commitment to aspire to do better. What are a few of the characteristics that you or Henry Ford looks for when they are saying, hey, it's time to promote someone into this new role that's going to have greater responsibility over people and Henry Ford's value proposition? What are the characteristics that you're looking for?
I love that you referenced Simon Sinek, because he is I think a role model for many, and I've had the opportunity to meet him and love his message. And I think that in medicine, as we've been discussing, you have to put others first. That to me is the ultimate litmus test for if someone says they're passionate about medicine, the why, being able to help people. And so that embedded already is this concept of servant leadership. But, when I'm looking to potentially, when I'm interviewing or looking to promote someone, you look upon the arc of their experience, and did they always put themselves first, or did they bring other people along? And I think that, what I tell my chairs of our 18 to 20 departments now who are growing, it's not about you anymore. That your role as a chair, you will get all of the halo effect and the kudos of the successes from those in your department. So put your effort into mentoring those young faculty members who are trying to write their first grant, or who are trying to build their patient base and their referral network, or whatever it might be. Because at the end of the day, a collection of mentored superstars who are grateful for the opportunities that you've given them as a mentor, it just reflects back on you and exponentially. And so I think that most people, I think, on our team get that, and it's something that I think we just constantly should model, because to me that makes all the difference.
Are there programs within Henry Ford that reinforce some of these leadership traits or characteristics to, like for a high potential group, let's say?
Yeah, so it's a great question that you're asking. One of the things I'm doing later this afternoon is sitting down with our executive team and deciding upon, and this is, I dread it and I love it at the same time every year, but we have something called the Physician Leadership Institute. And so we've invested for the last 15 years, every department gets to nominate, one person, and there's room for about, 9 or 10 across the system of, sort of young to early mid-career physicians who we feel have a lot of potential for leadership and for being kind of the tip of the spear for our health enterprise. And it's so inspiring to see the journeys and the stories of these people, but there's always, 3 to 4 times as many as we have spots for. So I dread it in the sense that, how are we going to select from among, this great group? But yet, it gives me hope that our bench is deep and that there's interest, and, it's an annual thing. So, hopefully there'll be enough time and opportunity for to get all of our young superstars through. But we do, we really, understand the importance of creating these protected time opportunities for leadership, because some leadership is innate, but there are some skills that I think you need to be exposed to. And in our world, having people in your world and with financial expertise embedded into medicine and sort of change management skills and how to have difficult conversations with peers and understanding and taking a national pulse and figuring out what our strengths are here in Detroit and Henry Ford, and how to tap into that to create the biggest bang type of a thing. These are all topics that I think can be delved deeper into during specific training opportunities.
When we partnered with Henry Ford on the Game on Cancer a few years ago, I was hearing a term that really struck a chord with me: financial toxicity.
Yes.
Can you speak a little bit to that?
So it is a heart-wrenching and heartbreaking concept that, imagine that you are diagnosed with cancer, or a loved one is diagnosed with cancer, and that in and of itself is so much to deal with. And you're going to doctor and nursing visits, you might need surgery, you might need chemotherapy and radiation therapy, but all of these efforts around the medical aspect of cancer are dizzying and critically important just in and of themselves, but what gets lost is that the fact that people are taking time off for work, even to get to treat themselves, but to take a loved one, if it's your mother or your father or your spouse, they may not be able to earn as much at their job, or they may lose their job, or they may not be able to be strong enough if you're a patient to complete their job. And not everybody has disability insurance or savings to weather them through this storm. And so you would be shocked. I know I was shocked at the number of our patients who, when we started asking and figuring out, they're actually making a decision between their copay on their chemotherapy prescription or their electric bill or their food bill or their grocery bill. And this concept of if they become immobilized and they need a wheelchair to go up into their house, there's no resources to build a ramp or to make modifications and so forth. So this concept of financial toxicity that you mentioned really is a scourge among cancer patients and families that we also try and shine a light onto. So yes, we're handling all of the medical treatment side of it with precision medicine and targeted therapy, but at the same time, we also need as much support as possible so that people and families going through this journey don't have to make even more sacrifices because of not being able to pay for basic things. And it's not as if, these are people who've had jobs and who have been hardworking and never missed a payment. But, many families are one paycheck away from not being able to pay their rent or for, basic bills. And cancer, unfortunately, one of the many devastating aspects of it is the potential to wreak havoc on all aspects of life. So that's something that we try and focus on to alleviate.
No, and I appreciate you expanding on that and sharing that with our listeners. I was extremely impressed as I visited with a few different physicians on that topic after I began to hear it spoken of often. I was like, well, what exactly is that? And to just know that Henry Ford as an institution, as significant of an institution as it is, not just in the Midwest, but serving patients across the country, that's a priority of theirs. And that's a conversation at the table with the decision makers like yourself and Mr. Lassiter and others.
Yeah. Well, Wright has been an amazing CEO, and you mentioned Wright Lassiter, and I think that our commitment to this is that's how we lead. That is what we lead with, because we want to be the solution for the entire person, the entire community, not just when they happen to be, in their appointment dealing with a medical issue. So that's something that is critical, and Manny, I want to thank you for your support for Game on Cancer, and you may not know this, but when you stepped up and when this enterprise donated, it forced a lot of other people to say, well, maybe I should do it too, and it matters. I mean, it does
Thank you for saying that.
It does create a crowdsourcing sense of we can actually make a difference. So thank you.
Yeah, we appreciate that, and I love it. R.J. King often speaks about the rising tide lifting all boats, and
yes.
We try to do our best to do our part and be a part of the solution. It's the aggregation of marginal gains, right? It's the aggregation of marginal gains. We're getting ready to wrap up. Maybe 30 seconds on the vision of Henry Ford as you look at the next 10 years. Are there specific things that are extremely high priority, something that's unique, or just the vision in general of the organization?
Yeah, thank you for asking. My moonshot to my team has been, over the next decade, I want Henry Ford to contribute 25 practice-changing innovations to healthcare across the country. And I say this with full confidence because what many people may not realize is that in the 1990s and early 2000s, the New England Journal of Medicine, the most premier medical journal in the world, came up with its top 10 innovations in medicine in the last century. And most people don't realize that 3 of those 10 came from Henry Ford. So, it's in our DNA, this concept of how to treat stroke, of robotic surgery, of sepsis management. These are all Henry Ford contributions to the world, and it's time we not only picked up where we left off, but to, zoom into the future. So that is definitely what excites and inspires me. So,
well, I'll tell you, as you said that, one, I did not know that. I'm not surprised I didn't know that, though, actually. But, we do believe that attention is today's greatest currency. And when we have the right audience's, the correct audience's attention, it's important to, with humility, be really proud of our story. Yes. Right. And Henry Ford, it's an incredible story. It's a story that should be told. It's a story that should be marketed and promoted with great pride, not just internally within your culture, but with your partners in the community. And I would say this has definitely been one of the more enjoyable conversations I've had in a long time, especially on the podcast. I'm thankful that you were with us. I know how busy you may be. Is there any last thought or comment that you'd want to share for our listeners before we go?
Just thank you. Thank you for anyone listening who supported anyone in healthcare, anyone going through this crazy tsunami that we all weathered together during the last 2 years. I think we can declare that maybe it's not totally over. COVID is something that we'll probably have to live with at a chronic level, maybe yearly vaccines and boosters and so forth, kind of like the flu. But it was not lost on anyone that we weathered it because of the support of the community. So thank you.
Yeah. Thank you again for leading an organization that's a leader in our community.
Thank you. This has been awesome.